The United States Agency for International Development has issued notices to PEPFAR-funded HIV organizations, terminating their funding for good. This comes just 38 days after US President Donald Trump signed an executive order imposing a 90-day freeze on almost all foreign development assistance, pending a review. The termination notices went out overnight on Wednesday, 26 February, leading to consternation among health workers and activists in the HIV/AIDS sector as key programs face the imminent collapse of their services. Hi, my name's Tamsin Metelerkamp, and I'm a journalist with Daily Maverick and Maverick Citizen. PEPFAR, or the US President's Emergency Plan for AIDS Relief, is a global health program started in 2003 that constituted about 17% of South Africa's 44.4 billion rand campaign for HIV counseling and testing. PEPFAR funds are distributed to South African implementing partners through the USAID and the Centers for Disease Control and Prevention. And about half of PEPFAR-supported programs in South Africa were receiving their funding through the USAID. It's not just South African organizations that are being impacted by the USAID funding cut. Trump's administration has said that the agency made a final decision to axe nearly 5,800 awards worldwide, while retaining about 500. The cut also affected health programs that receive USAID funding from sources other than PEPFAR. In the termination notices sent out to USAID implementing partners, it was noted that the terminations were for convenience and the interests of the US government. Organizations were informed that their programs were not aligned with agency priorities and not in the national interest. In South Africa, PEPFAR funding has been focused on hard-to-reach gaps, such as supporting children and pregnant women and key population and community-based services. The USAID cuts will have a potentially devastating impact on the country's fight to end the HIV/AIDS pandemic. Some impacts of the USAID terminations include the loss of most data capturers at public health facilities, which affects monitoring and evaluation efforts, minimal HIV screening for children in maternal and child services, limited support for advanced HIV disease services, which service high-risk patients such as pregnant women, the potential loss of pre-exposure prophylaxis services for adolescent girls, young women and pregnant women who would be cut off from critical HIV prevention tools, limited TB testing and screening, and the closure of drop-in centers, clinics, and mobile outreach initiatives. The Inova Health Institute, an organization that assisted the South African public health system with TB and HIV care, lost all its funding. Dr. Kate Rees, a public health specialist at Inova, described the abrupt cut in funding as being pushed off a cliff, rather than having the opportunity for a controlled handover of services. Experts and health workers in the HIV/AIDS sector have called on the South African government to take urgent action to address the gaps that have been left by the termination of USAID funding, saying that the country can't afford delays if it's to prevent a loss of the ground gained in the fight against the disease over the past 2 decades. They warn that many lives may be lost among our most vulnerable populations if an emergency strategy is not found, and found fast.